the devil's in the detail. The right to be housed is a very complicated question on who provides that right and how it's delivered.
Well, that libertarian principle, what was it, rational self-interest. You know, for crying out loud, this is rational self-interest. You know, maybe we just haven't marketed philosophically with targeted message to the philosophy of those we're targeting. You know, we keep banging our moral fist on their door, and somehow or another they don't listen. What if we put more rational self-interest into it?
Well, you know, I come from a healthcare background, so I engage in a lot of debates where I'm coming to the table with data and numbers and arguments, and I'm engaging with people who are talking about their strong beliefs and convictions. You know, one time I got into a very public dialogue with someone about vaccines, and I flat out accused my opposition. I said, look, you're bringing feelings to a numbers fight. Stop. And you know, one of the things that is interesting as we talk about philosophy of homelessness and talk about, you know, the right to be homeless, the right to be housed, the right to health care, sometimes, you know, when you look at the housing first model, you know, how does housing first help people? You know, this is not my belief. This is the best evidence and best practice. You know, does putting people in housing help improve their health, help decrease the strain on the criminal justice system and the emergency healthcare system? I mean, the data is not controversial at all. Absolutely. You know, and to top everything off, it's the right thing to do. We as a just society should be doing this. But you don't even have to engage in the moral argument most of the time when you're talking about policy.
Well, and I sort of, an interesting comment on this too. So I tend to think that whenever people who ordinarily disagree with each other come to the same sort of conclusion, you have some good reason to think something's gone wrong. And so actually, so you could meet two different kinds of, or at least two different kinds of like moral language resistance to this way of talking about the homelessness problem. So on the one hand, you'd have the human dignity folks saying, well, look, if we just want to reduce this talk about homelessness and homeless people to just pure economic concern, that what we've done is given up their human dignity. So we can't only talk about it in that way. And so that would be a point of resistance for folks who want to support homelessness. And then on the other side, or want to support like providing housing and so on. But then on the other side, you could get the resistance saying, well, look, we can't provide the housing in the way that you're suggesting, because they don't deserve it, and they haven't kind of they don't have the moral worth or whatever that's invested in it. But the end result in both cases would be we shouldn't talk about it in this way, right? But these are people in the economic way. But these would be people who would be ordinarily in opposition. So that would lead me to think that actually the way you're suggesting is probably the right way to do it, because we've ended up with these two ordinarily conflicting sides.
We aren't a very forgiving, non-judgmental society, generally speaking. Garrison Keillor said, we Christians are always asking God to forgive us of things we wouldn't think of forgiving anybody else of. And in a lot of ways, we have judged the other with a stricter standard than we have judged ourselves in many, many cases. And I would submit that that is kind of something that ought to be considered too on the asking others to fund this. We really need to be careful with what is our buy-in, what is our sacrifice. Once again, Bob Dylan, money doesn't talk, it swears. There is a sense in which money has been a handicap. That back to the Stoics, back to the Cynics, Diogenes. For him, money was a problem. He very clearly states that it has a negative effect on the virtues that he would have wanted to see. And have we disciplined ourselves with regard to our share? Are we a charitable people in our own personal lives? And again, I know many of you are, but if we're going to demand it, we must show it. I guess is what I would say.
It is one caution also in talking about philosophy of homelessness is running the danger of not addressing the philosophy the justice, the morality of the individual components that helped, were the root causes of the homelessness of the different parts. You know, to talk about the right to housing without talking about the shortcomings of the foster system that may have resulted in someone being homeless. To talk about the right to housing without talking about intimate partner violence and domestic violence, which is one of the #1 leading causes of homelessness for women. To talk about the right to housing without talking about the fact that one of the big causes of homelessness is chronic disease and an inability to access affordable, effective health care. To talk about the right to housing without talking about people that are escaping trafficking. To talk about the right to housing without talking about the complete inability to access mental health, substance abuse services. You know, in a lot of ways, we're asking some of the wrong questions, or we're asking questions in nowhere near the right depth. And that's where, you know, in talking about the philosophy of homelessness, you know, we have to look at cases case by case, and we have to take a look at the root causes for homelessness. Because I know, and I'm gonna praise him because I know he's too humble to praise himself. One of the things that Chuck does so well is looking at people's narratives. And when the business owner is saying, hey, that guy is sleeping out in front of my store panhandling, and he smells bad, and he urinates on himself, and he's driving away customers, and Chuck says, well, that guy who's sleeping out in front of your store was a veteran and served his country and suffered a traumatic head injury and post-traumatic stress disorder and was unable to get health care and became estranged from his family and is self-medicating with alcohol and now has nowhere to go. All of a sudden, there's power of narrative. Now all of a sudden, the store owner is no longer you know, a very calloused capitalist, but a member of our amazing Santa Barbara community, and wants to invest in social resources, not only with his or her money, but with time and political influence, to see to it that that homeless veteran not only gets access to housing, but access to mental health services and health care. And
It's a true story.
And you know, and this is what Chuck does for a living. You know, this is what he does. But it's the case by case. It's not, does this person have a right to housing? It's this person, like Sherri says, is a person and an agent, and B, really has a right to access mental health services, substance abuse services, healthcare services, housing services, and is entitled to benefits for the service he did for his country in the armed forces. So, you know, everything's case by case, and there's, for every question you ask, there's always 1,000 questions underneath, which is one of the challenges of working with the homeless.
Awesome, thank you so much. So we're gonna have one more question, and we're gonna open up to everyone here for a Q&A. I just wanted to ask for everyone that showed up tonight, and also just maybe the community as a whole in the Santa Barbara area or the United States or the world, however you want to look at it. What do you think people should be thinking about more with regard to homelessness? What should people consider when they're approaching this issue that maybe doesn't get talked about enough? We're done.
So I've actually mentioned some of these things already, and I say this at almost every gathering. But I'm a little puzzled by the philosophical component of it. So we were talking about, several of us, all of us, I think at some point have said that it's a case-by-case issue to be solved. So, and I'm curious sort of what the moral implications of that are, because we can't, in other words, we can't solve it philosophically if we're dealing with it individually, which is an interesting problem. But Jason's point is well taken, and he's giving me too much credit. I have to give credit to Jeff Schaefer and Luke Barrett, who are far more skilled in the work that he's talking about than I am, of this ability to talk at multiple levels to bring out everyone's humanity. That's where we see change with any social problem, is meeting people where they live understanding their needs and trying to bring the common humanity together. That's how it works. That's how we solve it. And the cool thing about homelessness is that we can solve it. I mean, in other kinds of social problems and things like violence against women and racial problems in our country, and even the clash of rich versus poor, that some of these problems are not as easily solved as homelessness, because in fact we know the techniques and the things that work over time, and we even understand the resources needed to build our way and to house our way and to provide enough services in the way to get out of this. But I would say that it's critical for Santa Barbarans to understand that we have a housing crisis that is mind-boggling. And most people just don't want to acknowledge it. The vast majority of people who are considered homeless are not the people we're talking about on this panel. They're families who are working 2 and 3 jobs, who are living in, and you use the term unstably housed. That's the biggest group. And that's a huge percentage of people in Santa Barbara. And in fact, Santa Barbara County has the highest percentage of children in that category in the state of California. Santa Barbara. So we have this crisis, and yet whenever I raise this issue, I don't hear it in the political mainstream, because even last night at the City Council of Santa Barbara, you had people saying, we're building too much housing. There's too much going on. We can't grow this fast. Yet 20,000 people a day come up from Ventura for jobs, drive on the freeway and clogging the freeway, causing environmental problems. Tens of thousands of others live in far-flung places and are commuting to work here in Santa Barbara. The housing crisis extends to all levels of our society here. And the homeless problem across the country is almost like the canary in the coal mine, where they're the most visible evidence that we have a broken housing system. And regardless of your beliefs, if you believe in a free market, we don't have a free market for housing. Because every unit that you build of housing, what is it, the mark that they were talking about, 600 square feet, they're charging $2,900 a month rent. That's an example of a market that's broken. That doesn't make any sense anywhere. So, clearly there's a demand and a need to expand. We can get into debates about what's sustainable growth and important, but the reality is that we as a society have not recognized this housing problem, this housing crisis. And that's got to be something that is on the public agenda.
Anyone else? I think the big question is the interconnectedness of all the issues. That usually when someone asks a question about homelessness, you can tell when they understand how all of these issues are interconnected or not. And what I find is it's not about availability of housing only, but that's an important part. It's not about access to health care, but that's an important part. It's not about access to mental health care, but that's an important part. It's not about revising the foster care system, but that's an important part. It's not about services for veterans, but that's an important part. There are so many moving parts to this issue, is the first part. And the second part is homelessness is an issue that a lot of people have opinions on. And a lot of people are very willing, whether you want to hear them or not, tell you their opinions. But what we really need is political will. And we need activism. We need people to be asking the right questions, and instead of complaining about it, getting involved. That is the fabric that our American democracy is built on, and that's what we need more of, both locally and at a national level.
I guess we'll sort of build on the sort of suggestions that you're making. So I remember my freshman year of college, I was taking some sociology class or something like that. And they asked the question, all right, so like how many people in this room think homelessness is an important issue? Or how many people in this room think food security is an important issue? And we went through a number of things that we thought were important. Some people, most of the people raise their hands in the room. These are things that people tend to think are important. And then they would ask the question, well, how many of you people have done something to specifically address this issue in the last couple of days, last couple of weeks, last couple of months? And the reality is, I would imagine every person in this room thinks that these issues are important, but it's not clear the extent to which every person in this room has done something to deal with one of these issues in the last couple of days, couple of weeks, couple of months. And I mean, I'm going to imagine this is a fairly active group, given that you've come here to this talk tonight, and I think this is taking some amount of action. But it's really easy to spend a lot of time thinking about issues, and as a philosopher, I spend a lot of time thinking about issues and not as much time doing about them. But it seems like, totally apart from spending the time thinking about these things and talking about our theories of justice, that we need to take action in order to kind of increase justice in the world. And it can be really scary. I know for a long time when I started working on, so I'm the chapter founder of Minorities in Philosophy at UCSB, so we work on issues related to underrepresentation in philosophy. When I first started, I had absolutely no idea what I was doing, and spent a lot of time trying to get educated, and now I do a lot of organizing in Southern California. But like, if you think these things are important, and you're here because you're interested in issues associated with homelessness in California or in Santa Barbara, then it seems like the next step is to go out and do something about it. And maybe you can talk to one of these gentlemen afterwards to figure out what you can talk to.
Okay, thank you. I would like to open it up for a Q&A now. If any of you have questions, feel free to address them to any particular panel member, or you can ask them generally, shotgun style, and anyone who'd like to can pick it up. Go ahead.
Yeah.
Well, going back to the question of the right to be homeless, I know that a lot of the, like Casa Esperanza, I understand, used to be open to all homeless people, but at a certain point it was decided to change its format so that you were required to be alcohol-free and substance abuse-free in order to qualify for the housing there. And so, and that's what I hear over and over again with a lot of arguments about the right to be homeless, and that is, it seems like that's almost the wrong question. It seems like the real question is the criteria that is put on the homeless people to qualify for this kind of housing that then keeps them out. And so they say that they want to be homeless, but really what it comes down to is they want to be free of that kind of restrictions on their behavior, which oftentimes are substance abuse issues or mental health issues. So then it comes back again to a question of our healthcare system.
If I could answer that one. I really have always framed this as an Americans with Disabilities Act issue. Not because I want to pathologize all the folks on the street and say, oh, you have a disability that we can diagnose. This isn't about diagnosis. This is about access to a fair share of the community. We have not made ramps up to care. We have not made ramps up to housing, metaphorically or actually. You attempt to access public social services, public health, and so forth. And if you are a person who is hearing voices in that moment, think about it for a minute. Have you ever gone into your bank and tried to get your checkbook balanced, or gone on to an 800 service number and had to punch this, punch that? Think about that if you were a person that was hearing voices in that moment. We have not, that's one of the things we have in Doctors Without Walls now, our group companion care. We accompany, we do not enable, we accompany folks through the process as a neighbor. It's kind of a neighborly gesture, and we found that to be very, very effective. You know, it is a tough thing thinking about accessing. How do you apply for Social Security? How do you apply for Social Security disability? How do you apply for food stamps? Think about that. If you don't even know where your driver's license is, your ID, your birth certificate, oh, I lost that, it got stolen from me, it got tossed by the police. These folks need companions in the process. You want something to do, that's...
And I think the question of, you know, and it's too bad some that representatives from Rescue Mission and Casa Esperanza Path aren't here. The question of a wet shelter versus a dry shelter.
Yeah.
A lot of people are looking at that as far as efficacy, as far as access. one of the challenges we have here in Santa Barbara is that we don't have enough shelter beds. And you know, I would never try to speak on behalf of PATH, because there are a lot of people that are really struggling or self-medicating themselves with alcohol, recreational drugs, who are very nice, polite, agreeable, and would do well in a shelter system, but are denied access to that because of alcohol and recreational drugs. But there's just not enough beds to go around, and one of the challenges we have in thinking of philosophy of homelessness, the question of justice. How do you allocate scarce resources of shelter beds? Who do you give the scarce resource to, and who do you turn away? Is a complicated question that a lot of the different shelters will look at and spend a lot of sleepless nights thinking about, because that's what I know we in healthcare, Doctors Without Walls does not turn anyone away, but there are some patients that we'll see that are under the influence of alcohol and recreational drugs that we decline to see at that time. At that time, because you know, we have a lot of late night conversations, philosophical, existential conversations about the patients that we have to turn away. So I think you asked very, very tough questions.
I also have a sort of direct reply to that. So my father would be an example of a person who used drugs and alcohol, and who would regularly try to access various kinds of shelters, and found it very difficult to be able to stay in these places. So even when he was able to get sober for a short time in order to utilize the resources, was not able to stay in a situation where they're controlling his behavior in this way. So I mean, it was strictly no drinking, strictly no using any substances, strictly no fighting. And so if he did end up doing any of these sorts of things, there was pretty much a zero tolerance policy on it.
Yeah.
So you take a person who's been actively using drugs and alcohol for 30 or 40 years of his life and put him in a situation where they're saying, no, now you can't do this. Even his best attempts at staying sober for a while, the first time he had like a bipolar episode, he would immediately go back to using substances and immediately would be back out on the street.
There are some wet shelters out there in the United States that have that allow people to come in intoxicated, but do not allow use on the premise, and have harm reduction models, and have very specific behavior guidelines. Like, you can come to our shelter intoxicated, but you have to be polite, you have to be respectful of others, and they're very effective. And I think we're starting to gather a lot of good data, and hopefully.
I believe that PATH is that model. So in other words, Casa Esperanza has gone through a variety of different programmatic changes. When it was taken over by PATH, they were told by the community that they needed to be a sober facility. The rescue mission is not. So you can go into the rescue mission intoxicated as long as you behave, you're not causing violence and things like that. But PATH is actually a harm reduction, and the idea is that you can have a programmatic bed at PATH if you're willing to start to move towards, or the ramp towards homelessness. So the ramp that Father John is talking about is the PATH model. Housing First is the model that says harm reduction happens immediately when you get someone housed, and you bring the services to support them in the housing. Now, we don't have a strict Housing First model here in Santa Barbara, but in San Luis Obispo, they implemented a Housing First program called 50 Now. And they used, from a philosophical standpoint, it's kind of interesting what they did. They triaged using an assessment called the VI SPDAT, and the most vulnerable people were the people that they served first. And they put them into housing, and they gave them the services, and something like 85 to 90% of their people are still housed after a year and a half. They've seen something like an 80 to 90% reduction in the use of emergency rooms. I mean, it's just, the statistics are overwhelming to support the Housing First model as opposed to other kinds of interventions. And so, you know, I agree that we need more shelter, because shelter is an emergency service that people desperately need. But by the same token, I think the more we can do to get people housed and with services in-house.
And when you say Housing First, again, I like to emphasize that it's not my belief that Housing First works. That is the best practice. The evidence supports Housing First. period.
Yeah.
There's no controversy.
In Isla Vista, we have a Housing First house, Pescadero Lofts, on Camino Pescadero, 761, 32-unit, formerly homeless from Isla Vista, that's been there for better than 2 years now. It's kind of a modified Housing First. We do expect good behavior, but yet we aren't sniffing folks as they walk in the room and excluding them because we catch a whiff. And it's been transformative for a number of them. And
Well, and it's made, you know, so one of the myths about homelessness is that if you house people, just more homeless people come.
yeah,
We've seen now over 2 years
yeah,
a stable reduction in the number of homeless
Yeah.
people in Isla
Yeah.
Vista as a result of Pescadero Law.
yeah, it's pretty amazing.
And just to you know, I've asked a lot of people why they believe that myth. Like Jason, why do you waste your time giving people health care? It's just going to cause people to come to Santa Barbara. People are going to come to Santa Barbara
For free health.
all over the world, from all over the world, to get the free health care that Dr. Sutwells provides.
Yeah.
But to think that way, you have to have a logical framework of thinking.
Yeah.
And a lot of people are homeless because of circumstances, either mental health,
Yeah.
they're not following that logical health care, that logical framework of thinking, or because they have ties to Santa Barbara when they became homeless. They have a
Yeah.
job here, they have family here, this is where they grew up. So the philosophy of if you build it, they will come is a flawed philosophy at so many different levels and just not supported by the literature.
But just one other quick point before we move on, and that is when you said that there aren't enough beds available in Santa Barbara County for the homeless, I would argue that there are, but unfortunately it's the county jail. And even Sheriff Brown has said that his department, his police department, has become basically the place of first resort now for the homeless and the mentally ill. And that's primarily
The number one provider of mental health services in the county of Santa Barbara is the criminal justice system,
Criminal justice.
Right.
without a
The
close
funding is.
second.
Yeah.
I think the emergency department, we might be approaching
Yeah.
number two,
Yeah.
but
Yeah.
yeah, and that's and you know, and when you talk to the brave men and women in law enforcement, you know, they tell you they didn't go into the business of protecting and serving to
Be social.
to criminalize people's bad circumstances that made them
Yeah.
homeless. That's not why they
And
do
there are,
that.
but there are some wonderful collaborations that are beginning. Things like restorative policing, clean and sober courts. We are talking to one another in ways that we did not talk 20 years ago. That's the fact. And more and more law enforcement officers, including many from the UCSB police, are beginning to see part of their role as social work. And they can be very efficacious there because they're tip of the spear, their first contact in many cases. So there are some really hopeful signs too. It's not all bad. I don't know whether any of you ever saw that Dr. Seuss book, If I Ran the Zoo. You know, it's if I ran the zoo, here's what I do this, I do that. And I have a copy of that book on my desk in my office, and I often think about that. If I ran the zoo, what would I do? Well, I'm going to retire in a few months. Yeah, and I am not going to get a Winnebago and put national park stickers on it. I'm going to act. in
Well,
ways that
I want you
couldn't.
to know I'm part of the resistance of you retiring.
Yeah.
I make no apologies for that.
Well, I'm not done. I'll tell you, it is time to act in ways that maybe I couldn't have when I was drawing a paycheck. Does that make sense?
That makes sense.
Okay.
Do you have any more questions? Yeah.
I just walked in, I saw signs, I wasn't looking the whole thing. So maybe you can answer this, but as students at UCSB right now, what do you think is the number one thing that we can do to help?
You guys, some of you student health folks.
Join the show.
Yeah.
There's a student organization on campus. It's called Street Health Outreach. I'm one of the leaders of Street Health Outreach. Liam and Monica are the other leaders. They're also here tonight. You can come talk to us, and we can connect you to getting involved. I think that would be the easiest thing, and then just go from there. There's a lot you can do.
They do a lot of exciting things. They work with us in the parks. They help with the coordinated outreach in Isla Vista.
Yeah.
They work with Doctors Without Walls. It's pretty amazing.
Yeah, good stuff.
And this is one of the most active campuses I've seen on this issue.
Yeah. And keep asking the right questions.
Yeah.
People evade the question or refuse to answer it, and hold people accountable to the questions, especially our policymakers.
Yes.
They work for us.
And Father John actually he framed it in one of the best ways I've ever heard. A lot of what people need is companionship, and there are ways to do that where you don't feel you're personally at risk. So there's organizations in town, and if people are interested, I can direct you to them, that will provide you that opportunity. So if you want to spend some time just having a conversation, having a meal with somebody, and maybe helping them figure out how to get their driver's license, or figure out how to get their social security card, or maybe take them to a doctor's appointment. These are little things that have huge implications for people.
And I think to take what Chuck said a step further, as students, don't try to be the hero. If you see someone homeless on the street, inviting them in to sleep on your couch is not maybe the best course. But there are a lot of organizations in town that are doing really effective work. And you're UCSB students. Use your critical thinking, ask the right questions, ally yourself with organizations that are doing effective, impactful work that is in line with your values. And understand that homelessness is a complicated issue. By working with victims of rape, you're doing your part to combat homelessness. By working with victims of discrimination, you're doing your part to combat homelessness. Homelessness, it's not just about getting people housed. It's about addressing the myriad of root causes of homelessness, and find the cause that you believe in, and find people evade the question or refuse to answer it, and hold people accountable to the questions, especially our policymakers.
Yes.
They work for us.
And Father John actually he framed it in one of the best ways I've ever heard. A lot of what people need is companionship, and there are ways to do that where you don't feel you're personally at risk. So there's organizations in town, and if people are interested, I can direct you to them, that will provide you that opportunity. So if you want to spend some time just having a conversation, having a meal with somebody, and maybe helping them figure out how to get their driver's license, or figure out how to get their social security card, or maybe take them to a doctor's appointment. These are little things that have huge implications for people.
And I think to take what Chuck said a step further, as students, don't try to be the hero. If you see someone homeless on the street, inviting them in to sleep on your couch is not maybe the best course. But there are a lot of organizations in town that are doing really effective work. And you're UCSB students. Use your critical thinking, ask the right questions, ally yourself with organizations that are doing effective, impactful work that is in line with your values. And understand that homelessness is a complicated issue. By working with victims of rape, you're doing your part to combat homelessness. By working with victims of discrimination, you're doing your part to combat homelessness. Homelessness, it's not just about getting people housed. It's about addressing the myriad of root causes of homelessness, and find the cause that you believe in, and find